All right. Good morning, Mr. Miller.
Good morning.
Hi. How was your night?
Pretty good. Pretty good.
Good.
No complaints.
I see you were able to eat some breakfast.
I ate a little bit of toast and some coffee.
Good. Nausea's a little better?
You would think coffee wouldn't be good for nausea, but I feel all right.
Wakes you up. So this morning is going to be similar to yesterday. We'll start with doing some exercises in the bed.
Great.
And sit you up, watch your blood pressure a little bit, and hopefully take some steps.
Sounds good.
All right. 0 to 10, how are you for pain control?
2.
Wonderful.
Sometimes even 1.
Yeah. Did you get any sleep?
I got some. You know, they come in and do a lot of stuff to you. But I'm a great sleeper. So.
Oh, good. I came in at 5:30 and took some blood.
Yeah, I didn't even keep track after
Take over there. Yeah.
I came to a place where I like those leg things.
Oh yeah?
Yeah.
That's comforting?
Well, yeah.
That's good. Okay, let me grab your cheat sheet here so you know I'm not making this up.
Okay. Don't try this at home, boy.
Alright, would you like your leg in just a skosh?
Sure.
Okay. Good. Alright. Top of the lid, we'll start with those ankle pumps.
Oh,
there you go.
Those are easy. Why don't you
Yeah.
cover my toe so it doesn't stick out? Oh, what happened there?
Yeah,
Are
they try
they
to make this
oh.
so your toes don't get
Oh,
compressed.
that's
That's why
fine. I
they
thought
give
I'd
you.
put a hole in it.
Yeah.
Doesn't matter.
No,
That's fine.
they do that so your toes. Yeah, it's gonna be
It doesn't
persnickety.
matter. Yep. Well, this is the easiest one. If I can't do this, I'm in trouble.
So make sure
And
you do
you
your
wanna
whole
bend
foot.
more.
Yeah, there you go. Nice. And you get that nice pull back
We
there.
do some of the same thing in yoga.
Oh, good.
Yep.
Good. All right. Nicely done. And the next one on here is to push both your legs flat down. That's better. And relax.
Both at the same time.
Push down.
I wasn't getting much push yesterday.
No, it seems better today.
I couldn't really find it or control it, you know? It was so...
Yeah.
And with the anesthesia, I had a hard time making that leg do what I wanted it to do.
Yeah. Well, most everything you're able to do except for just that one thing. I think just, you know, extensive surgery. He got a little insulted, but it looks like he's coming back to work today.
Yep.
Good. All right, let's do 3 more of those. Push down, hold, and relax. And I like that you're breathing, not holding your breath. Good.
That helps.
Okay.
What are we trying to do with that one?
That one's just kind of waking up the muscle, kind of getting some circulation. You get a little stretch in the back of your leg there. All right, the next one is also a squeezy one. We're going to squeeze your bum.
Yeah, I was good at that one.
All right, I'm going to recline you just a skosh.
Can you even tell if I'm doing it?
When I recline you again.
Okay.
All right, so you're going to tighten up the back. There you go. Good, and hold that, hold, and relax. So sometimes you feel a little pull by your incision, but that's okay. We can't hurt that incision.
Yeah.
Good.
It's pretty bulletproof.
Yeah, very bulletproof. And then relax. Hold. Good. Okay so far?
Yep.
Good. Another one? Try to do about 10 of these. I'm going to recline you a little more so we get a little more stretch in the front of that hip, okay?
Good.
Good. Okay. Good squeeze. Oh, there you are. Good, and relax. Okay, this one I'm going to have you whisper to the count of 5 with me so you don't hold your breath.
Okay.
Okay. So you're gonna squeeze. 1, 2,
3, 4, 5.
Great. Okay, 2 more.
1, 2, 3, 4, 5.
Good. is, I don't know.
1, 2, 3, 4, 5.
Gentler than counting out loud, I guess.
Yeah, I guess.
For variety.
Not
okay.
Not so military. Maybe.
That's right. That's right. I'm the very opposite of military.
Yes.
Okay. All right. So I'll help you with this next one. We're going to slide your knee up and down.
Right. Which one do you want to start with?
This one I know is going to get a lot of work done, so we'll just practice this one today. So we'll just.
Feels like that leg is really stiff.
Yeah.
I don't know if that's its reaction to.
That's pretty normal because you do have some swelling around there.
Okay.
So the first few usually feel stiff and then it kind of loosens up.
Good.
Okay. I got it. You can let it go down.
Again, breathing, huh?
Yeah. So these are meant to be gentle, non-strenuous.
All right.
Okay.
Sounds like you talked to a lot of guys who just power through it.
Yeah.
A little tightness in the knee and a little tightness.
That's from your swelling. Now, is this something that was difficult to do before your surgery?
Good question. I couldn't bend. When we do things in yoga, the classic is sitting down and bend forward. I am bending forward. You know,
oh, yeah. You were just kind of went so far and then it wouldn't go.
But
yeah.
This was okay before the surgery.
Good. One more. There you go. Nice. And back down. Still at a 2?
For pain? Yeah, it jumps to 4 as we try to do it, but that's okay.
And then it goes away.
Yeah. One thing I like having you here is that, you know, sometimes you don't know if we're into the old realm of no pain, no gain.
Right, right.
Or the new realm of,
yeah.
Well, if it hurts, you better not do that.
Yeah.
And so with you saying we're not going to do any damage to it, that helps me.
Yeah. I say the no pain, no gain works with the knees, but usually that's a
sounds a little 60s or barbaric or something.
All right, you're going to let that go down.
That feels pretty good to tell you the truth.
Good. Okay.
Feels like it needs to stretch.
Yeah. All right.
Do we worry about the other one or not? No.
Yeah.
Okay.
You're going to get a lot of exercise on that one when
Sure.
we get up and walk around.
And this is the adductor.
Yeah, this is the sliding out and back. So we want to make sure we keep your toe kind of pointed up and not, you know, rotating out as we go.
So, do I hold the left leg flat and...
That leg can do whatever is comfortable.
Okay.
Okay.
And we're going for some sideways.
And this is usually the second hardest one.
How much are you doing?
About half. Go ahead and relax.
You are doing
Good.
half.
Yeah. Because this one likes to help a lot. We're trying to get the one over here.
Okay.
Yeah, so you can let your leg drag.
I once went to
That's better.
physical therapy where they were talking about muscles firing or not firing. They just weren't helping.
Come out again. I'm just taking the friction away down here.
Okay,
there you
good.
go. That's mostly you.
Good.
Is this one a 4?
Yeah. That's
pretty good pain control. Oh, good. You got Ann as your nurse today.
I've had a consistent parade of nice people today.
Good.
Very nice people.
2 more.
I think I am doing that.
Yeah? I'm just taking the friction away. It takes the muscles a couple times so they know they can be brave, right? They know what to expect.
So what I'm learning from you is there's a couple of things. One, there's the old stretching it and getting some movement, but there's also getting that muscle to turn on.
Yeah. Because when you're stiff, it doesn't want to work as first. You kind of got to do it a couple times for it to kind of loosen up.
Does it atrophy? Or does it just know that it's going to hurt? So
No, it can't atrophy that fast. Atrophy is something that happens over time.
Yeah.
But we would say maybe it's inhibited.
Yeah, it's inhibited.
All right, last one, not least, is we're going to roll a towel and put it under your knee, and we're going to straighten your knee. I know this is a terrible picture because it looks like the guy is crossing his legs.
Yes.
But that is,
we don't do.
which is one of your no-nos.
That's right.
Do you remember the other two no-nos?
Oh, don't bend over from the waist. And don't take any wooden nickels.
Good.
Oh, what the third one?
The other one is don't let your knee turn in.
Okay.
Twist it. Okay, go ahead and slide just like you did. And yesterday we talked about trying to lift your legs straight up off the bed is a lot of force, and we don't expect you to be able to do that
So we're
quite
going
yet.
just from the knee?
Just from the knee.
Okay. Should I lift it?
Yep, go ahead and kick that ceiling. Oh, that's still really tricky today. Let's fix yourself here.
Is it the quads that lift that?
Mm-hmm. Yeah.
She's literally
So I'm
trying
gonna
to get it
I'm gonna lift it and let you hold it up here. So this is again trying to push your knee down flat. Okay, I'm gonna let it down slow. Good. And Colin came to see you this morning.
Uh-huh.
Did he look at your knee? Or did he just check your incision?
Check the incision.
Okay. Alright. Okay. Kick again. Kick. Good. Hold. Squeeze. Push down. Yeah, he's having a hard time waking up today. Okay.
Do it again?
Yeah, let me bring you up. Good. And try to push down. Hold that up. Hold that. Kick that ceiling. There you go. There you go. Kick. Man. I'm not going to get that cute carpenter in here to fix any holes. You're not helping me out.
All right. We got one? Yeah.
Alrighty.
Kick some holes.
Okay. Well, good news is it's not going to get in the way of our walking for now. Go ahead and keep scooting forward till that touches the floor. There you go. Okay. Want to come forward a little more?
Sure.
There you go. Okay, we gotta watch that lean and forward scooting too.
Mm-hmm.
Alrighty. Okay. This foot go down all the way?
Yep.
There you are. Okay. Alright. How's the woozies this time?
Better.
Good. Looks like they got you a little patch too.
Yeah, that may have helped. Thank you. So, we want to be thinking about 50% of the weight
Yes, I
on
was
the right.
just gonna start talking about after I got you.
What is this little guy?
This is my safety belt, so I can steady you if you're wobbly or woozy.
Good.
Plus, my dad said when I find a good man, I should hang on to him. So
There you go. Good.
gotta do what your dad says.
That's exactly right.
Okay. So 50% means if you're standing up with your weight equal between both legs, that's 50%. And you can pick up your operated leg, no problem. We don't have to worry about anything when you're picking it up. When you're picking up your opposite leg, that's when you need half your weight through
Okay,
your
well, I'm glad
arms.
you defined 50% because I was assuming incorrectly that it was half what you usually put on, half of the weight bearing. But in effect, it's 50 from each. Is that what you're saying? Each one is 50?
When you're standing,
This one is, or,
normal, you are 50-50.
right.
But as soon as you unweight this leg,
Uh-huh.
this leg now is responsible
Got it.
for 100% of your weight.
And we don't want that.
So we're going to use the walker
And your
To
arms
take-
take over?
50%, so your leg stays 50% and your arms get 50%.
Got it.
Mm-hmm.
Okay.
Yeah. So what it's going to look like when we walk is it's going to look like the walker being your frame, your operated leg forward, so you can lean on the walker and take that weight. And I think today we'll just kind
I think I
of
can
match
do
your
that.
step. We'll do
Yeah.
a step 2.
Good.
Okay? All right.
Happy to give that a try.
Okay, do you remember the one or none rule?
I don't.
Okay, so this walker isn't going to give you much leverage if you pull on it with 2 hands.
Oh, yes.
So when you're sitting and standing, let's wrap this around again. You can have one hand up on the walker and one hand pushing up from someplace that's stable, or you can have none hands on the walker and both hands push up from
Well,
there.
the walker doesn't look like it's going to go anywhere, so I'll go for 2 hands.
Okay. Good.
Not so bad.
Yep, okay. So I'm not going to have you shift weight on that leg while the knee is bent. I'm going to come down and help you straighten that knee before you put more weight on there,
Okay.
all right? So this would not be typical for the hip.
This feels like a exhibition I saw last week of kimonos, where you have stiff fabric like that, and you need a dresser to dress you.
Kimonos are actually very comfortable because they pack all sorts of padding in your low back with that ribbon, and it totally relaxes your shoulders. It's really nice. Okay, so I want you to push your heel down so you're tightening the muscles in the back of your leg. Good. Okay. How's that feel?
It's good.
Okay. So we're using, because this muscle on the front is a little weak after surgery, or actually a lot weak after surgery, we're going to use the muscles in the back to help you keep your legs straight.
Okay.
They only work well if your knee is pretty much straight. So if you're trying to put weight on this leg with your knee flexed, it's going to, be difficult to control. Okay. So I'm going to have you practice just swaying like a tree in the wind. So, and then when you come here, remember to put weight on half your arms when you sway this way. Good. Half your weight on your arms. Keeping that leg straight by pushing your heel down.
Particularly now that you
Put weight through your arms. Good. Nice. Okay. Okay, I'm going to have you pick this leg up and put it down. Good. And then straighten that, push that heel down. Good. Okay. Pick this leg up. Put it down. Straighten it out. Good. One more time and we'll sit down. Good. Put it down and straighten it. How are you feeling in the woozy department?
I'm starting to get a little sweaty.
Okay, let's have you put this leg forward a little bit. That'll keep that hip angle open when you sit, and reach back with one hand.
Scooch that way?
This way.
That way.
There you go. Good. Okay. One more turn. Good. Okay. You can lift this leg up in the bed for me, and I'll help this one. That should feel better.
Yeah, it's good.
Give you a chance to relax a second, and then we'll get you higher up in the bed. Straighten out this wrinkly thing.
Shall I pull on this?
You ready?
Yeah.
Okay. Go ahead and use this leg too to help. Oop, hang on. Bend this knee for me. Good. And you're going to bridge up, and I can kind of help straighten out this blanket. Good. Okay. Beautiful. Okay.
It's better.
All right. Now we get to ice you down.
All right. Sounds good.
I think I'm just going to leave you nice and flat for a minute.
Good.
So I have you on my schedule again for 1:30, so
All right.
after lunch again.
All right. I'll look forward to it. Wonder what old Bo Jackson had to do when they wrecked his.
You know, I bet they let him lollygag around in the bed, because I don't think they were into the early mobility after hip surgeries back then. So
But they did too.
I think you're gonna show him up.
Why do we push for more mobility now?
Why do we want patients to be more mobile
yeah.
early?
It's safe for the joint. It prevents stiffness. It prevents scar tissue from lying down in the wrong places and restricting your range of motion. So we just start early moving. So scar tissue is aligned well. The muscles don't go on vacation. And it's also good, as you've seen, you've had a little bit of trouble with your blood pressure and everything, and those things would be exacerbated by long-term bed rest. So they found mobility is better.
Good.
So any other questions for me this morning? Before I get your ice?
See you at 1:30. Huh?
Okay. Well, I'm going to get you some ice and get a pillow in there, and then we'll probably sit you back up a little bit. So.
Sounds good.
Okay.
Thank you.
You guys have any more questions for me?
So, you're the full-time rehab person, correct?
Mm-hmm.
That kind of coordinates the care for that. How many people do you typically cover in a day?
Here, I because we see the elective surgeries twice a day. I see about 4, so 8 to 9 patients a day. Yeah.
And then a typical patient with his kind of surgery, what do you expect the outcome to be?
So most of these patients will be able to go home post-op day 2 or 3 sometimes if there's a little extra trouble with blood pressure. So so the goal is that he can get out of bed pretty much by himself, walk with an assistive device, a walker or crutches.
Get off some meds.
By himself, stand up and down, get around the house, and so they kind of want you kind of lay low the first couple weeks, at home, and do your exercises and kind of recover and some walking, and then they'll gradually progress the activity. So to be fairly independent at home and up and down stairs if you need.
And what would you say about 1 year from now? What could a patient typically expect?
Mostly after 1 year, patients are feeling pretty normal. I've had people tell me that, about the first 3 months you're feeling pretty good, but to feel, close to the other hip, it does take about a year, just for continued strength and healing. So, but most of his recovery he'll see in about 3 months.